Hi, I'm Dr. Michelle Sieffert.
And I'm Adrienne, a nurse here at Donaldson Plastic Surgery.
And welcome to the Donaldson family. The purpose of this video is to help prepare you for your upcoming procedure. So please listen carefully to all of the instructions and call the office if you have any questions. You will need to be nicotine-free for 4 weeks before and 4 weeks after your procedure. This includes vaping. In the 3 weeks before your procedure, obtain any imaging, lab work, and medical clearance as prescribed by your surgeon. You will need a family member or friend available to take you to and from the surgery center and stay with you for 24 hours after surgery. Ensure that you have taken appropriate time off of work and that you will have the necessary help at home in the week or two following surgery. Continue to practice good skincare. This includes body rolling if you're having a body procedure. Also, remember to practice good nutrition, which includes eating whole fruits and vegetables and lean proteins and avoiding starchy carbohydrates and sugar. It's important to get appropriate protein during this healing process, as protein is the major building blocks of your cells. I recommend 50 grams of protein and drinking about 72 ounces of water a day. If you do get sick in the week leading up to your surgery, please let your surgeon know as soon as possible. Seven days before surgery, stop taking any medications that would increase your risk of bleeding or blood clots, especially medications like aspirin, NSAIDs like ibuprofen and naproxen, blood thinners like warfarin and Pradaxa, and oral contraceptive pills and estrogen supplementation. Find a comfortable place in your home where you'll recover after surgery and set up this area with everything you will need in the week after surgery. The day before surgery, you can expect a phone call from the hospital or surgery center to review your health history and give you an arrival time for your procedure. The night before, take a shower and wash your hair and body with your regular shampoo and conditioner and soap. Don't apply any lotions, fragrances, cosmetics, or deodorant. Pack a bag, which will include your signed consent forms, your ID, your health insurance card, and crackers and an electrolyte drink for after the procedure. Do not eat or drink anything after midnight the night before your procedure unless otherwise instructed, and try and get a good night's sleep. The morning of surgery, you will take nothing by mouth unless otherwise instructed. Certain critical medications will be allowed as directed by your anesthesia and surgical teams. Please remove any piercings, jewelry, dentures, and eyewear, and leave them at home.
The day of surgery, you will arrive about an hour before your actual surgical time. The hour will be used to get you through the registration process, for which you will need your photo ID, a health insurance card, and your signed consent forms. Once that is complete, a nurse will take you back to the pre-surgical area to get you prepped for surgery. You'll change into a gown and do a quick urine pregnancy screen. They'll hook you up to things that look very familiar, like a blood pressure cuff, a heart rate monitor, and they'll monitor your temperature. An IV will be started, and your anesthesia team will come in and meet with you to answer any last-minute questions you may have. After that, your surgical team will come in, answer any last-minute questions, and do their surgical markings. When all of that is complete, you and your team will head into the operating suite. The day of surgery, you're going to want to arrive to the hospital or surgery center wearing comfortable clothes. This means a shirt that either zips or buttons in the front, a pair of pants that are easy to get off and on like sweatpants or pajama pants, and a pair of shoes that you can slip into but not out of. So nothing like a flip-flop, but an easy tennis shoe would work. You're also not going to wear undergarments the day of surgery.
Upon completion of your procedure, your surgeon will step out of the operating room and update your caregivers on your progress. In the meantime, you'll be transferred to the recovery area, already dressed in your surgical garments, which you will go home with. Once you're sufficiently awakened from anesthesia, your family members will be brought back to the recovery area where discharge instructions will be discussed. If you are not already given prescriptions, these will be sent home with you from the surgery center. Once you're discharged, you can begin a diet of clear liquids and crackers and advance to a regular diet as tolerated. If you are experiencing nausea or vomiting post-operatively, please take the anti-nausea medication that was prescribed for you.
After surgery, you will wait 48 hours to remove your surgical garments and any dressings. Take a shower using regular soap, pat dry, and reapply your surgical garments. You're going to take your medication as prescribed and add a stool softener if you are taking pain medication to prevent constipation. If you have a drain in place, you're going to strip, empty, and record the drain amount as instructed in our drain care video.